Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on gastrointestinal gram-negative rods. Until now, we covered up about so many bacteria, which is associated with causing the diseases in the gastrointestinal tract. And we already discussed about one bacterium called as Campylobacterium, Campylobacterium species. So Campylobacterium species, in previous lecture, we discussed about the two notable example. The two notable species of Campylobacter. The one is called, very good. It's a Campylobacter jejuni, and another one is called as the Campylobacter coli. Most of the gastrointestinal discomfort, which is caused by the genes Campylobacter, is the Campylobacter jejuni. Approx 80%, and rest 20% is caused by the Campylobacter coli. We already discussed that this Campylobacter species is a gram-negative rods. What it is? It is a gram-negative rod. Apart from that, it's a microaerophilic, and commonly we acquire this bacterium, through the contaminated food, So it also causes the gastritis, or also called as the food poisoning. So one of the significant bacterial species which causes the food poisoning is the Campylobacter species. Got it? No problem. And I uploaded already the lecture about the Campylobacter, but due to some sound problem, I'm just summarizing the previous lecture. And the main motive of the today's lecture to establish one link between the Campylobacter species and one disease, an autoimmune disease called as GBS. See, Guillain-Barré Syndrome. What it is called as the Guillain-Barré Syndrome. It's an autoimmune disease. What it is? It is an autoimmune disease. Autoimmune disease means those diseases, which occurs due to our own immune cells attack the normal cells. This type of diseases are called as the autoimmune diseases. Auto means self, and immune refers a capacity to fight with the diseases, So here what happened, the immune system, which is you can say designed to destroy the foreign particles, mistakenly it start destroying our own cell and result into the autoimmune condition. So the Guillain-Barré Syndrome is it's a autoimmune diseases. Fine, no problem. So let's make the heading GBS and Campylobacter jejuni. Campylobacter jejuni and GBS. So write it the full name. Guillain-Barré Syndrome. So first try to understand what is Guillain-Barré Syndrome. As I said, it's a autoimmune disease. It's a autoimmune disease. Now you know the meaning of autoimmune. Autoimmune disease. Now the second thing is that why we are discussing the Guillain-Barré Syndrome with the gastrointestinal gram-negative rod, that is our Campylobacter. Why we are discussing? Is any relationship? See, relationship is always about a two-person, but sometimes it's something called self-relation. Self-relationship. So before establishing a relationship with another person, we have to establish a good relationship with yourself first. If you are, if you are, you can say harmonious. If you are harmonious with yourself, then you can be harmonious with others. Fine. So first we discuss the Guillain-Barré Syndrome, then we will try to establish a link between the Guillain-Barré Syndrome and Campylobacter species. Fine. So the first thing you should keep in your mind, it's the autoimmune disease. It is also called as post-infectious post-infectious immune-mediated neuropathy. Mark the word neuropathy. Was that too much big? No, too much big word. So I have to make it short. See, check the words post. Okay, post-infectious. It means this Guillain-Barré syndrome. It's a result of infection. It's a result of infection. First of all, immune-mediated. Okay, it is occurred by the immune system. We already understood that it's a autoimmune disease. Okay, it's autoimmune disease, and this autoimmune disease occurs not in all the cases. First of all, keep in your mind, not in all the cases. Yeah, generally in 80% cases. How much? 80%, and it's a significant percentage. No, it's a significant. So we have to consider that this disease is occurred. Okay, you can say after the infection, and that infection was can be a bacterial infection or viral infection. Okay, mostly the bacterial and viral infection. Clear? No problem. And whenever you have the bacterial infection or a viral infection or any other microorganism mediated infections, your immune system, your bodyguard cells take the charge and start, you can say, fighting with the foreign particles, okay, the foreign organisms. Clear? No problem. So it's immune-mediated neuropathy. Neuropathy is a group of, you can say, a disease which affects the nerves. Clear? No problem. And mostly the peripheral nerves. We have the two types of nerves called as cranial nerves, okay, and there are others called as the peripheral nerves. So this neuropathy is mainly affect the peripheral nerves. Clear? No problem. So this Guillain-Barré syndrome is a post-infectious immune-mediated neuropathy. Now you got the point. It means this disease is, you can say, most of the time occurs due to the any antecedent infection. Any antecedent infection means any bacterial or viral infections which occurs, you can say, prior to this Guillain-Barré syndrome. Because in 80% cases, patients reported that they had suffered from some of the bacterial or viral infections. Okay, and after 6 to 8 days or 1 month, okay, a patient have these syndromes called as the Guillain-Barré syndromes. Clear? No problem. Now, so what this syndrome actually is, what it is, okay, what is clinical significance, what's the sign and symptom? Now, the sign and symptoms is, you can say, there's a 2-3 any, and see, there's no any specific sign and symptom. Okay, there's no any specific sign and symptoms of Guillain-Barré syndrome, but generally the sign and symptoms goes with the weakness of muscle. Weakness of muscle. Okay, weakness of muscle, and this disease first affect the muscles, and then it lead to the you can say a more drastical condition of the muscles called as the paralysis. So there is a ascending paralysis. This weakness started from the lower limbs. Okay, weakness started from the lower limbs, and it's in the ascending order. It is in the ascending order. Then slowly it's affect the upper limbs as well. Okay, and that lead to the conditions called as the paralysis. So there is a ascending paralysis. Ascending paralysis. Now, you know that the peripheral nerves, okay, is, you can say, present all over the body. It is present all over the body. And if this weakness of muscles, okay, is about a longer time, okay, it's about the longer time, then it affects the facial muscle, okay, it affects the facial nerve. Apart from that, it also affects the respiratory muscles and respiratory nerve. And you know that if there is any problem in the respiratory muscles, patient have problem in breathing. Patients have problem in breathing, or you can say there is a respiratory distress. And that is a emergency condition. That is emergency condition. You have to immediately put the patient on ventilation. Otherwise, you lose the patient. So there is also a, you can say, respiratory muscles paralysis. Paralysis denotes loss of sensation, okay, loss of sensation of the muscles, okay. And it can be the half of the body or full of the body. Fine, no problem. So this is generally the three characteristic symptoms of the Guillain-Barré syndrome. But these symptoms are, you can say, also present in certain other diseases, okay, like in the case of certain, you can say, the tetraplegia, okay. Tetraplegia means weakness of the entire four limbs, okay, weakness of entire four limbs. And mainly, generally, there is a one called as the one ticks, okay. There is one ticks which secretes certain neurotoxin, okay. There is a ticks called as the American ticks, as well as the Rocky Mountain ticks, okay. Rocky Mountain ticks, you should write it down. It's better to write. Yeah. There is something called tick paralysis. Ticks paralysis. Now this ticks paralysis, it is caused by two notable ticks. The one is called as the American ticks, another one is called as the Rocky Mountain wood ticks. Rocky Mountain wood ticks. Clear? Now, these ticks, it secrete certain neurotoxin. What is secrete? Yeah, it secrete a neurotoxin. Now, this neurotoxin, it will bind to the neuromuscular junction or one receptor called as acetylcholine receptor, okay, and it disrupts the communication between the nerves and the neurotransmitter. Fine, and that result into the tick paralysis. And that tick paralysis also shows these signs and symptoms. That tick paralysis also shows these signs and symptoms. Fine, no problem. Apart from that, there are other, you can say, one disease, and that disease is basically a problem in the facial. I already said, no, called as the tetraplegia, okay. The disease is called as the tetraplegia, and this tetraplegia, it affects the entire four limbs. It affects the entire four limbs, and that also shows the weakness in the facial muscles, arm, in the neck, okay. So you have to establish a certain clinical differentiation, okay, and also called as the differential diagnosis to arrive at a proper judgment that, okay, this is a Guillain-Barré syndrome. So in the Guillain-Barré syndrome, what happened in most of the cases, 80% cases, patients reported that they had prior any, you can say, infection, a bacterial infection or viral infection. Now, that's a one way to make a judgment about that this is a Guillain-Barré syndrome. Apart from that, if you analysis the CSF or cerebrospinal fluid, okay, there is increase in the protein number, okay. There is an increase in CSF protein. CSF protein is high, fine, and there is one term for this, and that is called, and this term is called as the albuminocytologic dissociation. Albuminocytologic dissociation means that the leukocyte number, the WBC number is constant, it's not increasing, but there is an increase in the amount of CSF protein. Clear? That's the one way to establish that this is a Guillain-Barré syndrome. Apart from that, the person generally, and the one other thing, as I said, that's they have the prior any anticental infection. Okay, anticental infection, no problem. Now, in certain cases, what happened? The patient have the weakness starting from the cervical region. Weakness starting from the cervical muscle or cervical region. Okay, that's the two thing. And other thing is the electromyography. So electromyography also help to establish a disease called as the Guillain-Barré Syndrome. Clear? No problem. Now you have certain insight why I am describing the Guillain-Barré Syndrome while I am describing the gastrointestinal gram-negative blots. Okay? Why I am describing? The one thing you notice that this Guillain-Barré Syndrome is occur in 80% of the certain bacterial and viral infection. Fine? So, one of the bacteria, okay, which have the higher link between the Guillain-Barré Syndrome and the bacterial infection is the Campylobacter. Campylobacter jejuni. Write it down. Campylobacter jejuni. So this Campylobacter jejuni is a one bacteria which is responsible for causing the Guillain-Barré syndrome. Now the question arises, how? Isn't it? The question arises, how? Since it is a bacteria, how can it cause the autoimmune diseases? It can cause, but how? I will tell you.